Good morning, everybody. This is our first little vlog or video session in which I will try to summarize the latest around the coronavirus and hopefully other stories. And obviously there are several issues that you may want to prod into and read in more detail. One of them, for instance, is the issue we discussed of fake news and conspiracy theories around the coronavirus. There is a nice, interesting podcast produced by The Guardian yesterday or today, which Andrew and perhaps others may want to look into when you want to prod into the issue of fake news. Related to that is a debate about whether fake news related to coronavirus or other related issues should be chastised or removed from social media. Facebook has been quite radical about it, and Twitter has decided to remove anything it considers fake news, which has raised questions about the freedom of expression and possibly a part repetition of the situation in China when some of the unwanted or undesirable messages around the coronavirus were being purged from social media by the Chinese authorities. This raises the question whether the West would be trying to avoid uncomfortable conversations or expressions of excessive criticism, maybe even rebellious questions or statements. And hopefully we are far off from that situation. Now, there is a huge issue around the United States and Trump's overtures to early return to fully functioning economy, and there are conflicting statements from different experts on epidemics and pandemics, economists, philosophers and others. It's a huge story that you may want to pursue and explore, because clearly the United States is still considered the world engine of economic growth and a propeller and a reviver after recessions. Obviously the discussion how deep this recession is going to be caused by the pandemic, whether it's going to result in a long-term depression. Some experts have been looking at the impact of the 1929 Great Depression, how long it lasted. Some people said that the world economy took up to 25 years to recover from that Wall Street crash. Now we have seen the zigzags on the stock markets, showing that the markets are not yet decided whether the world is going into a long-term or a shorter-term downturn in the world economy. So we hope to discuss the business and finance journalism just after Easter, but some of you may want to start reading up on that, because the pandemic and economy are so tightly related, raising the questions, saving lives or livelihoods, and the coverage of these issues is particularly incisive and really good if you sign in for the New York Times feed from America, which includes also global coverage of coronavirus. Now, things that may be uncomfortable to politicians and raised by the public related to the West can come to the fore a lot easier than rather almost taboo or uncomfortable questions about what impact the pandemic will have on the undeveloped or underdeveloped countries that either have no functioning public healthcare systems or are too poor to provide anything of consistent value and care. during the pandemic. Even though the figures may be very low for a number of African countries, the truth is that probably in time the instruments and structures available to the governments there are very limited in stemming the growth of the pandemic. A very good example is India, where the blanket order for people to stay indoors in a country of 1.3 billion people, out of which probably 300 million live outdoor effectively, is perhaps rather theoretical, and many people say cannot be enforced. Another country where the Western journalists started prodding into is Russia, which has a remarkably low number of recorded or official infections, but already the Russian authorities are admitting that the real number may be, and probably is, a lot higher. Simply there is not enough testing or genuine commitment on the part of the government, of the Russian government, to stem the epidemic, but the official policy is obviously to delay and restrict the spread of the epidemic. I'm not even talking about countries like Ukraine and others, which have also very low numbers of officially recorded infections, but the numbers may be a multiple of that, just as the mayor of New York, one of the cities with a very high number of infections, said that probably New York has got at least 10 times more people infected than it is recorded number, going towards 30,000. So it's a huge question whether we are in a position to see what the ultimate impact is going to be. Some people, as you may have read in America, have been saying the difference ultimately between trying to stem the spread of the disease and taking its course is probably minimal. In the end, in the last analysis, similar numbers of people will die, but a lot of experts beg to disagree. So it's turning into quite a philosophical and ethical dilemma, not only a kind of a technical or epidemiological one, about the impact and number of deaths. The predictions are of about 60 million this side or the other. It may be 50, it may be 80, but experts say that the Spanish flu of 2018 and 19, which produced something between 50 and 80 million deaths, had a similar mortality rate as the COVID-19. So they expect that a similar number of people will ultimately die of the disease. The question obviously is whether modern technology and strategies can protect the health services, and the example of Italy shows that it may be either very difficult or almost impossible. A lot of questions are being raised about whether the Chinese draconian system is going to be effective long term if other areas of China have rising infection rates, and the same military technique may not be possible to impose. In the case of Taiwan, a smaller confined territory, or Singapore, effectively a city-state, are very different. Those are very well-disciplined and organized societies, as is Japan. Can this type of militarism in exacting measures, like the UK is trying to impose, can they be effectively imposed on Western societies? Another question, obviously, is it true that the number of cases and the spread of the disease is in a way a function of the level of development of a given country, where the extent of travel, mobility, dynamism of economy, or urbanization are the factors contributing to the number of infections and ultimately deaths. Whether we're going to see in the long term an overhaul of the big trends, global trends of fast urbanization, big metropolis, and excessive, some people say, international travel. Are we going to see a radical decrease in international travel, a genuine virtual and remote home working practices to take root? That was predicted 20-25 years ago. Didn't really happen. People still prefer face-to-face and physical contact and interaction. And will that radically change the way we interact and socialize? Are we going to start emulating the clinical and sanitized practices of human contact as practiced in some cultures? For instance, in Japan and in several other cultures, people don't touch each other and have not done for ages, probably on account of germs and viruses, even though in those times, thousands of years ago, people didn't know about the existence of bacteria and viruses. Right, so the question now that I want to turn your attention to is, has the COVID-19 crisis contributed to the position of the NHS being now unassailable and completely immune to future attempts to either break it up, privatize it by stealth, or maybe selling it off to American companies? Has the thrust and drive towards total commercialization of our public life and all aspects of it is going to stop? Are we seeing processes that will revert further drives towards privatizations and commercialization of utilities, aspects of private life? We now know that, for instance, some of the rail franchises in the UK are being effectively nationalized or renationalized, at least for the time being. Will it result in people realizing that state-owned or state-run or managed or regulated bodies or institutions can run public services or utilities just as effectively but cheaply and at a lower price to the customer than the plethora and multitude of private companies that were set up and are competing very often on a specious level of competition, where the gauge for competition is very narrow, and sometimes the price differences are symbolic, giving us a sense of fake or specious choice, like on the supermarket shelves, 20 or 30 types of cereal are owned by 2 or 3 companies. Now, turning away from the NHS, which is obviously a wealth of topics in itself, the issue of how to support the dedicated people who have gone back into employment from retirement to support the effort, whether we homebound can support these people who are doing a crucial life-saving job for our society. Should that be institutionalized? Should the government encourage by kind of orders or decrees our cooperation with the NHS NHS services and efforts beyond simply sitting at home and saving lives by not going out? These are just a few topics that one can explore. I think I have covered most of the stuff I wanted to do, except for one, which is the role of the media. I'm kind of turning the full circle now when we were talking about the fake news and the importance of delivering a trustworthy, factual, and scientifically based information to people that need it at this time. And that raises the question of the future of the BBC, which in effect in the last months has been written off in a way, and people said that the license fee and the role of public service broadcaster is coming to an end. There have been very radical statements from the government saying that in this day and age the BBC as a public service broadcaster is an obsolete concept and should be either broken up or transformed into a different type of a service, maybe a subscription service. Now this pandemic, this crisis, has shown the importance of centrally regulated and administered operations, not only in the area of health services and administering human and social contact, but also in the area of information and management of communication, where the BBC and public service broadcasters can fulfill an extremely important role that the government communication services may not be capable of delivering to the same extent and as effectively as the BBC has done in the past. So this is my first contribution in video, which may be of some help to give you some pointers. Maybe it's not as polished and smooth and maybe not as coherent as it could be, but I would like to maintain your spirit and your motivation to work and exploration of stories and reading up about the crisis, which is an unprecedented crisis in modern history and perhaps in the whole history, because it never took place in the context of advanced communication technologies and connectivity and globalization. So this opens up incredible prospects and opportunities for you to contribute in terms of providing interesting, engaging journalism. And I would encourage you very strongly to run a daily log of the coronavirus from your own perspective, what you have done, what you have read, what happened to you, because that may feed into your later journalistic outputs that you'll be able to convert into parts of your or items in your portfolios. So good luck with it. Don't give up. Keep on working. And you know, your work will be seen, recorded, and remembered, because we are all in the midst of it. So I'll see you in a few hours, and I try to continue with those every day. Maybe not as rambling as long, but let's see. We will polish our products as we go along. Thank you very much.